Hi everybody, Nancy Sasaki, Executive Director at Alliance Healthcare Foundation.
Hi everyone, I'm Sylvia. I'm the Program Officer at Alliance Healthcare Foundation.
Going to ask me a question?
How is that?
It's not really.
Yeah, I do have a question sitting at me. What are you doing with that hat? Why are you wearing that
I am the
very
winner.
interesting hat?
I am the winner of the hat contest here at Alliance Healthcare Foundation. It is opening day at the races, and that's when everybody wears their crazy hats. So I just thought, since I couldn't go, I would be here in spirit. I'd be there in spirit. So,
Well,
you know, supporting community events, being out there in the community, that's what we do.
I know, I just forgot. I heard about it this morning, and I've always wanted to attend this particular day, but hey, this is a good start. I got to see the first hat.
You can wear it.
Okay, let me wear it. Okay. It's not going to match what I'm wearing, but oh well.
Hey, it didn't match what I was wearing either. Look at there. All right.
Since I couldn't make it to Del Mar,
that's
here
right.
I am.
That's not the
You're
tune,
still
is
the
it?
winner.
Okay, anyway, you know, one of the things we wanted to talk about, Sylvia found this great survey that was talking about findings on young people's attitudes that have been shaped by the recession. It was really interesting when I read it.
Yes, and
what
you
kind
know,
of struck you?
well, what struck me is that at first hand you can't really associate it with health and wellness and what's it got to do with kids' attitude. But as you read along, you realize that it does have everything to do with it. You know, first of all, these youth were all seniors from 3 different generations, and all of them were being surveyed at the time that the country was going through a recession. So they were all looking at the hardships that they were going to be facing and entering the workforce. So the interesting thing that I found, that the survey found, is that these youngsters have become so much more conscientious due to the way they're looking at life as they're getting to enter the workforce. When you have an attitude that you're going to graduate school, you're going to go to college, and you're going to have a high-paying career, they find themselves that that's not the case when the country's going through a recession. So 3 of the things that really stood out for me was, number 1, they are very socially conscious. They are more prone to conserve energy and have more of an impact on the environment. Use public transportation. Health-wise, they ride their bicycles more to work, so that's a really good impact on their physical health. And then even the fact that they want to work for organizations that actually have a mission, that are serving the greater community, that are not anymore looking for the nice corner office and the big paying job, but actually want to feel good about what they do.
Well, you know, one of the things when I was reading it, I was looking for the health stuff, right? And saying, well, so what impact does this have on health? I was really struck by the fact that they said they would eat differently to prevent starvation and for other people. So they would actually try to eat differently, healthier for themselves, but also try to make it so that there was more food available.
Exactly, and that's what struck me of how in a time when you would think they would be discouraged, there's a silver lining to
Absolutely.
the situation. Yes.
Absolutely. So if you wanted to find that particular survey, I just kind of Googled the effects on young people, recession effects on young people, and all kinds of things will come up, you know. But it was really done by the Russell Sage Foundation, so you can put that together and find the actual survey and read it for yourselves. It's very interesting. So I wanted to talk a little bit also about what's happening out in San Diego County. Yesterday I was at a meeting down at Liberty Station, and it was around the homelessness issues. And there's this whole federal thing called the HEARTH Act that's coming down, and it's impacting all of the communities and looking at how they are serving the homeless. And I was listening. The reason I went down is I wanted to hear about these transitional housing assessments that 3 of our organizations that are here in San Diego County have participated in. Because what we know is that to end homelessness, you're going to want to get permanent housing, right? First and foremost, it's permanent housing, right?
Right.
So they're looking at all the transitional housing that we have in our community and trying to determine how readily are they available to convert to permanent housing. And you know how they've got like dormitory style housing. That doesn't work because most people, if they want to think about it as their own home, they want their own front door in their own kind of front yard kind of setting, but not necessarily so. But it doesn't work to actually go into dormitory style housing. But it's been fascinating to learn about how we're recreating our governance, how we're consolidating effort, how we're going to try and use the same assessment to figure out where the homeless people need to go for housing.
It's amazing how things have changed and how we are able to move on to the next best thing to do. Because I'm thinking, for example, when you're talking about dormitory style, I mean, how could families ever go in that direction? You know, when you have children, I mean, there's no way that you can live in that kind of an environment and feel good. So I have heard for a while permanent housing is a way to go, and I'm so glad to hear that they're actually moving forward with it.
Well, there'll still be a mix. They still need the mix of permanent housing, rapid rehousing, transitional housing, and the shelters, but they're hoping to move kind of the inventory right towards the permanent housing. Yeah.
Right. Wonderful.
What else is happening in Imperial County these days?
Well, in Imperial and I think it's going to be 11 counties in California. They have this program through the county welfare system, and it's part of the AmeriCorps program. And you know, AmeriCorps is nothing new. Most of us know about it, and but most of their engagement of these youth has actually been within the school system, and then some nonprofit organizations, community-based organizations. But in this particular case, they're going to be using them in the CASA, which is the court appointment special advocates. And you know, we have one of our grantees in Imperial. They're going to be able to help. They're going to be completely trained by the welfare system. They're going to be able to manage the caseload, which, you know, we've heard so much of how overwhelmed the advocates, the CASA staff and volunteers are with the caseload of children that they have to manage. They're going to be able to facilitate parenting groups, do all kinds of crisis intervention. It's going to be a substantial amount of help. And then the other positive component about this is that these volunteers are welcoming this with open arms.
I bet. I'm sure they will. Absolutely. Hey, before we move into the grantee updates, I just wanted to remind everybody that you can send a question in on Twitter at AllianceHF. You can stump Sylvia. We also have a guest speaker coming up in just a little bit. You can try and stump her as well. But I've got it on Twitter at AllianceHF. Send us your questions and we'll try to answer them today. So, grantee updates. What's coming up? Who's doing what?
Well, there's a lot of things that are happening. Everyone is getting ready to post all of their events, so check out our Facebook page as well. We're going to be posting all of the events that are going to be happening in the fall. There's a great study that is going to be disclosed. The findings are going to be disclosed in Imperial Valley College through the Cancer Resource Center of the Desert. We have the Imperial Valley Food Bank fundraiser. All of these events are already in the works, and they're going to be giving us the final dates for them. So check them out at our Facebook page. We're going to be posting all of this information.
Oh, hey, I just remembered. I'm actually it's not Hat Day, but Saturday I'm going to the races to support Christie's Place. They're doing a day at the races.
Oh, nice.
But it's not Hat Day, so I can't wear my hat. Well, I could.
Well,
I'll be there anyway.
You've already worn it before the world,
there you go.
Who else
there
do
you
need
go.
to show it off to?
Well, I also wanted to mention for the Community Information Exchange that we funded through our innovation initiative, CIE for short, has hired their new director. So I just wanted to welcome Scott Beckler-Levin to being the new executive director of the Community Information Exchange. Really excited about that. I've worked with him for a while, but I think he's going to be a great addition to the team.
Totally agree.
I think we're going to really get that one off and running. I'm going to tell them a little bit about the workshop. This guy next to me that y'all can't see.
The star of the show that we can't see. We are planning the social media workshop for all of our mission support grantees in Imperial and San Diego County on September 24th at the Sim Center. It's a really exciting experience. Those that are return grantees are really looking forward to it. Actually, they pushed it because they've already had a taste of it. So I'm sure that those that are going to be their first time are just going to enjoy it as much. So
well, it's so impressive when you walk into the Sim Center, right? So if you've never been into the excited about it.
One of the reasons why they're asking me, when's it going to be? Well, now it's out there, September 24th.
Yeah, that's great. Our I2 finalists, our presentations are this Friday. There are 5. Yes. I don't know why, but this year I'm getting a little nervous. But I'm excited about all 5 of them presenting in front of for the board of directors and our blue ribbon panel. And you know, I think it's a tough decision for the board to decide whether they're going to fund anything or not fund anything and which one.
I think that's why you're a little nervous because you kind of have that perspective already that may happen.
That may happen. You never know. Yeah. Yes. Yeah. But so that's happening on Friday. Also, I don't know if y'all know this, but we've got a community survey out there right now, and we did this a couple of years ago, It's on our website. You can find that link and go and complete the community survey. Please do that. 2 years ago, we had like almost 70 responses back when we sent it out, and yesterday I looked and we had about 35. You got until the end of the month. So, double your efforts. No, don't go in and do it again. Get some other people to go in and fill out the community survey and give us your feedback, because it really does help us. I mean, that's how we broadened our perspective to health and wellness, was because of the feedback. Changed our logo.
That's our report card, and we're really looking forward to hearing from you, and it's the only way that we can make changes.
Yeah, absolutely. And surprise, today, we've got a guest with us today. So we're going to move Charlie in to join us. Charlie Popovich is the daughter of Kevin, who's on my right that you can't see. And we're about to get Charlie in here. There she is. Okay, so we can see Charlie now. Charlie's Kevin's daughter, and she's visiting for the summer. We're excited to have her here today. Welcome, Charlie.
Thank you.
Nice to have you, Charlie. I'm good.
Yeah, so we were talking with Charlie earlier, and the reason I invited Charlie on is that, we're all about health and wellness. And we're all looking at how we can eat better and eat healthier. And Kevin, this guy that you can't see over here, used to post pictures on his Facebook page of these awful plates of food that I was always having to say, really, Kevin, all this work around health and wellness, and that's what you're eating? Well, fortunately, there's been a change in the family to trying to eat healthier. And I thought it'd be great to hear from you, Charlie, about what's healthy eating to you, and how's that change been, and what do you think about all this?
Well, I think that it is okay to have sweets sometimes, but sometimes you have to make the better decision. Like, instead, when you think about having something sweet, you could choose an alternative, like fruit instead.
That's very good.
Very good thinking.
Absolutely. Yes. What's your favorite fruit?
Green apples.
Oh, green apples. Nice. So I heard you had some tips. What kind of tips would you tell people about eating healthy and making healthy choices?
Well, it is important to get plenty of exercise.
Very good.
You need to stay hydrated, drink plenty of water,
absolutely,
and possibly other things like Gatorade or something. You need to eat plenty of vegetables.
Yep. That's okay. It's all about when you're sitting down to eat, or you're thinking about, oh, I'd really love to have that ice cream. Just to know that you should stop and think, what could you do that's healthier, right? So how's your dad doing?
He's doing pretty good.
Is he?
Is he exercising?
He exercises a lot.
Yeah,
right?
He actually had a basketball game yesterday.
Oh, yeah? Very good.
Yes, but before that basketball game, he had Panda Express that he chose to
Charlie. Charlie, way to tell on your dad. Yep. And what did he choose to eat at Panda Express? Because you can eat healthy there.
I know, but he didn't choose to. He chose, what did you have? Angus beef or something? I don't know. And then some shrimp stuff that was just horrible.
Oh my goodness. Yeah. Well, I've noticed that he hasn't been posting pictures of his food plates much lately.
Yes, because I think that he has been so ashamed of what he has been eating.
Well, this wasn't supposed to be a bash on Kevin's eating habits, but I think that you really talked about some really good things that people can learn. And actually the drinking water thing is so important for people of all ages, but my mom is the worst. She even doesn't tell the truth about how much water she hasn't had in a day, and it's starting to affect her, but the hydration, even if you don't feel like you're thirsty, it's important to keep water in you, for sure.
I think water is one of those things that if you have it by you, you will drink it. So it's always good to have a bottle of water, because if it's right next to you, you will end up drinking. I have a question. Do you have friends that are like you in their mindset about eating healthy and exercising, or is it hard to find kids that, younger kids that want to go for the ice cream and the chips and the fries and the hamburgers?
Yeah, a couple of my friends are like that. They would, if they had ice cream or some grapes or an apple, they would choose the healthier decision. One of my friends, her family doesn't have dessert after dinner like most families would. Mm-hmm. All she does, she eats dinner and then it's done. She doesn't really eat anything.
Yeah, actually that's how I grew up. We never had dessert at home.
our
Yeah.
families don't like that.
Well, it's hard to make the changes. It really is. But I think it's great that somebody that's young like you is already looking at how you can make the healthier choices. And we really encourage everybody that's out there to make healthy choices in your life as well. We've got the perfect weather for getting out there and doing things,
Absolutely.
being active. And when you're active, you've got to drink the water. And, so just take one idea, just like we've talked about before. Stop eating the French fries and add some vegetables. Just one little change will go a long way to eating healthier and being healthier in your life. Right, Kevin? Right. Okay, just checking to see if we have any tweets. Seeing none, I would just like to thank you all for joining us today. Be healthy, be well, and don't forget to like us on Facebook, LinkedIn, Twitter, Pinterest, all of those social media spots. But really go in and find out about what's going on in our amazing community here in San Diego and Imperial counties.
It was a pleasure being today with you all. I hope you enjoyed the information we shared, and we look forward to being with you next month again.
Thank you so much for joining us,
Thank
Charlie.
you,
welcome.
Charlie.
Thanks.
It was really fun.
Good.